Welcome to the Barasch McGarry webinar for Jersey police, fire, and all responders, frankly. We represent hundreds of firefighters and cops from New Jersey, and there are so many questions that we get asked all the time. Plus, there's this deadline looming for the entire 9/11 community that we want to share with you because we're hoping that you, in turn, will share it with the people who are not on today. We're going to be starting with a short video. You're going to see Jon Stewart, our hero in Washington, who was more responsible, well, with the unions, frankly, for getting the health program and the victim compensation fund permanently extended. We have some real wonderful guests. We have Liam Lynch from NICOSH, and Liam's going to talk about the health program. We have Valerie Velazquez-Stetz, a former Jersey City police officer and now a 9/11 first responder liaison and advocate. My partners, Dom Penson, Dana Cohen, Lee London, and James Steiner will also be addressing some of the common issues about the Victim Compensation Fund. Deputy Chief Richie Allies, formerly of the FDNY, please, those of you in New Jersey, do not hold that against him. It's just that's where he spent his entire career. And Richie is now Director of Outreach at Barasch McGarry. And I thought his special take on the health program in particular would be of interest to you. So Richie, thank you for joining us again today. And this video, by the way, it really was made by Jon Stewart and the other speakers to implore people who were not first responders to register. But there are so many people outside of New York City that don't realize that they are entitled to the same benefits as the New York City firefighters and cops. So that's why I thought the video was appropriate. So go ahead.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
I want to start by talking about eligibility. This is the map that Senator Gillibrand referred to. If you were in Lower Manhattan, or you went out to the Fresh Kills landfill, or you went to any of the makeshift morgues, you are going to be eligible for the Victim Compensation Fund. And for those of you who came from New Jersey, whether you were assigned, whether you volunteered on your days off, it doesn't matter. If you were downtown, you are eligible, and you should take advantage of what you are entitled to. All right, Lee, would you take us through some of the more common illnesses associated with the World Trade Center toxic exposure?
Sure, and thank you everyone for joining today. So skin cancer right now is the #1 condition New Jersey first responders, volunteers have been developing now. It takes that long for skin cancer to develop. When the dust settled on your skin, basal cell, squamous, melanoma, I talk to people every day. Oh no, I wasn't diagnosed with cancer. And then when I get into skin cancer, they said, oh yeah, I had basal cell. I have this on my forehead. This is what we need. We need people to join the World Trade Center Health Program, get the research, and make sure that everybody gets their annual skin checks. When the Zadroga Act was created, it was broken down into 2 entities. You have the World Trade Center Health Program on one side, and you have the Victim Compensation Fund on the other side. Both cancer and non-cancer conditions are covered. And just like Michael stated before, if you were down there and you have the amount of hours and in the exposure zone, you don't need to prove the causation that your prostate cancer was caused by your exposure. It is already linked. It's presumption that it is already linked to your exposure. That's why I have so many clients that say, oh, my father had prostate cancer. My private doctor told me that my cancer might not be related. You have to go to experts that know 9/11 exposure, because it doesn't matter that your father or your brother had prostate cancer. It's presumed, and the cancer is caused by 9/11. So other than prostate cancer, breast cancer, thyroid cancer is a #1 cancer we're getting calls about now, because the skin over here where your thyroid is the thinnest, and that's where the dust was able to get into your body. Other than cancer conditions, we have non-cancer conditions. We have interstitial lung disease, sarcoidosis. Michael Barasch represented James Zadroga. The act is named after. He passed away to interstitial lung disease. They found ground glass in his lungs. This is why it is so important that if you're not sick now, it's not how you're feeling now, it's how you're going to feel 5 years from now, 10 years from now. We want to make sure every first responder can join the program and register with the Victim Compensation Fund.
And you're going to hear us use the word presumption a lot. It doesn't matter if you have a family history. It doesn't matter to the Victim Compensation Fund or the health program if you are a smoker, if you develop lung cancer, esophageal cancer, if you had a family history of breast cancer or prostate cancer. The presumption is that it was caused by your exposure to the toxins. So, James, would you please talk for a minute about the deadlines? Because if there's nothing else that you take away from this webinar today, it's the importance of the July 29th deadline. James?
Absolutely. It's critical because, and especially when you're talking about first responders, like many of you are, because so many people who were enrolled in the World Trade Center Health Program were certified with illnesses and not necessarily, they didn't know about it. So when they went to the registry at the health program and were told, yeah, you have some respiratory disease, they were actually certified for that illness. And what the deadline said is that you have 2 years from the date that you're certified to register with the Victim Compensation Fund. And since people were certified back in 2011, they had no idea that the deadline had expired. Well, the special master fixed that, and she extended the deadline till July 29th of 2021. So what that means is you have to get your registration in now to ensure that you are protected and you can file a claim in the future.
Right, and I think it's important also to notice it's not just for people who are currently living with cancer or other respiratory illnesses. This deadline extension is for all the widows, widowers, the families who have lost loved ones. So if you know someone whether they're related to you or not, please reach out to their families. If you had a buddy who died in 2007 from prostate cancer, their family is still eligible today. Same for someone who died of breast cancer in 2011. Their family is entitled to hundreds of thousands of dollars, which could be financial security for them. And this is a wonderful thing that the special master has done, extending the deadline. But it's imperative that people reach out to their friends, especially the retirees and the widows who aren't going to hear about this unless they get a phone call from you. Richie, would you tell us a little bit about your own personal experience with the health program and your cancer?
Sure. First of all, it's an honor to be with my New Jersey brothers and sisters in police and fire. The last 9 years of my career, I was a union trustee for Local 854, the fire officers in the city. So I've been involved in this in the aftermath of 9/11 since 2007 and fighting to get the law, and it's become my professional passion. Being a long time, 38 years in the fire department, I was very health conscious because the job beats up cops and firefighters, right? So you have to make kind of a decision early in your career that you're going to do everything you can to take care of yourself. So I was always diligent about my health. So in the aftermath of 9/11, when the World Trade Center Health Program was created, I took full advantage of it. And now as a retiree, I make it part of my annual program. You know, every year you're entitled to an annual World Trade Center medical. So if I urge everyone, please take advantage of the health program and get that annual medical exam, because those that do not pay the price later on, because the cancers that we find are like cancers on steroids. So early diagnosis is the key. The second reason for going to the health program, any 9/11 related illness that requires any kind of prescription coverage, inhalers for breathing, omeprazole, things like that for acid reflux, is fully paid for by the health program. And even though I know with your unions, you have prescription coverage, but you always have copays and an annual cap. Never, ever, ever use your personal prescription union coverage for any prescription 9/11 related. One complaint that members make is that when you get a prescription from the World Trade Center Health Program, your prescription is delivered to your home. You don't even have to leave, to go to the pharmacy to pick it up. But one complaint is that prescription is only good for a year. So once you run out, it's not like you can pick up the phone and call the doctor and get a renewal. Why? They want you to come back for your annual medical. I completely agree with that policy. So payment for all out-of-pocket medical expenses and deductibles are covered by the World Trade Center Health Program, including referrals out to outside physicians for maybe you're having breathing issues. They send you out for an endoscopy or colonoscopy if it's age appropriate for you. Completely covered. I used to get my colonoscopy through my private medical insurance, and it still cost me over $250 with the hospital expenses and out of pocket and all of that. Now I don't pay anything. And most importantly, this is a national program, which I think that Liam is going to talk about, but any of you that retire and relocate to another part of the country, all of the same benefits that you'd be enjoying in the state of New Jersey can be transferred to any other state in the union.
Liam, perfect segue to you. Would you, first of all, tell us about NICOSH? What is that? And then talk about the national program.
Awesome. Yes, thank you so much. Thanks, Michael. It's a pleasure to be here. My name's Liam. I'm with NICOSH, which is a nonprofit, small organization, New York Committee for Occupational Safety and Health. And we worked with the labor unions, from the jump after 9/11 to get responders the PPE that they needed. And we really fought alongside them when testifying with Congress that this was a program that needed to be passed, healthcare and compensation for this population. Like everyone has said so far, you do not have to live in the New York metro area in order to receive care from this program. Many people think that this is just a New York thing. There are clinical centers of excellence in the New York metro area, including one at Rutgers. So there is a New Jersey Center of Excellence. However, you can receive care, and there are responders and survivors receiving care in all 50 states as we speak. And it is what we call in the program the Nationwide Provider Network, and that is administered through LHI, Logistics Health Incorporated. And they say that they will hook you up with a specialized healthcare provider within 50 miles, a 50-mile radius of your home. And it's a difficult. I'll be honest. We have the clinical centers of excellence in the New York metro area. We have all of these specialists with healthcare professionals, doctors, nurses, and they tried to replicate that nationwide, which is a very difficult challenge. And so if you are in the Nationwide Provider Network and you find that your care is not adequate, you have a right to transfer providers. This program really, really stands out. You have doctors who are specialized in treating 9/11 responders. They understand the unique circumstances of the conditions. They have the experience in caring for this population and that specialization. But also, this program is not static. It is designed, it's legislated to evolve with the changing needs of its patients. So if you join and you add more data, there is more information to add conditions and have them connected to 9/11 exposure. A really important point is that early detection saves lives. There is a long latency period between exposure and the development of these conditions. And what I mean by that is you could be exposed to, asbestos today. And research shows that, an asbestos was down at the World Trade Center site. And, you're exposed to asbestos today, you feel fine, and you don't develop a condition 20, 30, 40 years down the line. So that is why annual medical monitoring exams, which are part of this program, is crucial. That annually you go, you get checked up. And like Richie was saying, they catch things that other doctors are not because of the specialization. And treatment, includes medical tests, like Richie was saying, doctor visits, prescription drugs, surgeries. There's also a pretty robust benefit counseling program, and it is for both physical and mental health conditions. So PTSD is covered, anxiety disorder, panic disorder, and they have excellent programs for mental health treatment. I could go on, but I'm going to leave it here and pass the baton.
Thank you, Liam. I'm sure there'll be some follow-up questions. Valerie, I'd like you to talk a little bit about, first of all, it's nice to have you on. Thank you for joining us. It's nice to have a cop on board. Can you talk a little bit about your experiences with the health program in New Jersey? And also, what made you so passionate about all this?
Well, I have to give credit to my academy classmate, Joe Sorreo. He pushed me to do so, and I didn't want to because I just felt like so many other officers that nobody would understand, and I don't want to talk about it, and I just want to forget about it, and like that's blood money, I don't want that, I'm superstitious. So he was like, that's ridiculous, you should just get yourself checked out and see what it's about. So I the name Michael Barasch just kept falling into my face. I would see it somewhere in a magazine or a commercial or something, and I'm like, wow, maybe that's a sign I need to talk to this guy. And I reached out. It was very hard, and I actually invited Michael Barasch to come to a Jersey City retired officers Christmas party, and their families were there, etc. So he agreed to do so with Lee, and it was great. And we had folders, and it was about 25 people signed up or more, and they continue because now the word was out that Val's involved and she's helping out. So, and it was just unbelievable to me that so many Jersey City police officers, such as myself, that worked every day, and I was actually working that day at 7 a.m. and I don't even know when I was able to go home, probably midnight. So on 9/11, and we were just, in disbelief. And so many, everything came over to Jersey side because, they couldn't do much over there in the New York side. So we were going back and forth. So, and so many officers, so many volunteers, correction officers actually even helped out. They volunteered with Jersey City, Bayonne PD, Newark PD, the surrounding towns helped out. And officers throughout New Jersey, I mean, they just wanted to help. That's what we do. So we didn't think about all of these illnesses that we would, endure in the future. None of us thought about that.
I don't want to scare anybody, but look, if you already have an underlying respiratory illness, if you already have had cancer that required chemotherapy, your immune system is not what it was pre 9/11, before you got sick. So you need to be particularly careful. You need to be safe. This is not a political statement at all. It's just a fact. This is what Dr. Luft from the World Trade Center Wellness Program is telling everyone. You have to be careful, wear a mask, social distance. It's not a joke. Our law firm has already lost well over 100 people to COVID. And it's not a surprise. COVID is a respiratory illness. So if you have COPD or asthma, if you've had chemotherapy and your immune system is shot, you are more prone to get it and you are more prone to die. So please take care of yourselves. Great. Lee, we've been spending a lot of time on the health program. Let's talk about the Victim Compensation Fund, the other side of the Zadroga Act.
Sure. The number one benefit that I always speak about with the Victim Compensation Fund are out-of-pocket medical expenses, because cancer and respiratory treatment and care is very expensive. But if you were not part of the World Trade Center Health Program, when you were suffering through your cancer and chemo treatments, you can get that out-of-pocket medicals paid back directly through the Victim Compensation Fund. The World Trade Center Health Program will not retroactively pay you back for your out-of-pocket medicals. They will cover all future costs for your treatment and so forth relating to any 9/11 World Trade Center physical condition. The health program also covers mental PTSD treatment, but the Victim Compensation Fund only compensates for physical conditions. But out-of-pocket medical expenses is a huge claim that we make for many of our clients. And since the fund is extended and permanently funded, we can keep amending your claim to add as time goes on. And I will explain that to you. That means that if somebody gets an award from the Victim Compensation Fund for asthma, you never waive your future legal rights by accepting this award. God forbid, 5 years later, you get diagnosed with prostate cancer or breast cancer, we can amend your claim for an increased award. So one of the claims that we make is something called non-economic loss claims. They're for pain and suffering for your conditions. And these conditions can vary. Non-life-threatening illnesses can vary between 20 and 90,000. That's because you could have two people diagnosed with asthma. One person uses a nasal rinse once a month. The other person has had 5 surgeries. The Victim Compensation Fund looks at the totality of the circumstances. Just like with skin cancer, as Michael was saying before, basal, squamous, melanoma. Melanoma can pay up to 250,000. They range between 90 and 250,000 for these types of skin cancers. And all life-threatening cancers, lung cancer, bladder cancer, range between 200 and 340,000, especially with multiple conditions. But like I said, just because you're settling now does not mean you can't make another claim and make an amendment. And that also goes to an economic loss claim, loss of earnings. We have many firefighters, cops from Jersey, from all around the state, many New Jersey firefighters, volunteers. They retired in Florida, like Richie was saying. They retired all around the country. But if their cancers, if their World Trade Center physical conditions force them out of employment and cause them to go on disability due to their cancers, due to their respiratory conditions, we could make a loss of earnings claim, an economic loss claim to make you whole again. These benefits from the Victim Compensation Fund are unbelievable, and we want to make sure that everybody knows about it, from retirees to volunteers to the first responders like yourself. And now Dom and Dana will speak about the wrongful death benefits.
Thank you, everybody, for being here with us today. Lee described the benefits that are obtainable from the Victim Compensation Fund on the personal injury award. When you file a deceased claim, if we're talking about, for example, a family that never had the opportunity or whose loved one never had an opportunity to file a claim while he or she was alive, the family, when they file a deceased claim, can get that compensation, the compensation that their loved one was entitled to while alive. So the non-economic loss that we described, those awards of between $200,000 and $340,000, they're entitled to recover any of those, the lost earnings that their loved one could have obtained if they were disabled from work for a period of time prior to passing away. And then, of course, they're entitled to all kinds of benefits for the deceased claim. So there would be more money awarded for the conscious pain and suffering of their loved one. There would be direct awards to dependents, such as a spouse or children living with the person who passed away, or any dependent they had. It could be a parent, it could be a domestic partner who wasn't legally married. In addition, if there were lost earnings as a result of the death, the person's life was cut short prior to their work life expectancy, the family can recover those benefits too. And they can recover something called replacement services. The cost of replacing the kinds of things that their loved one used to do for them and around the house, outside of the house, things like chores or home repairs or maintenance, these things have a value. And the VCF recognizes that, and it will provide compensation for that. It will also provide compensation for any kind of funeral expense. And you put this all together, Michael said hundreds of thousands of dollars, and sometimes they add up to millions of dollars. These are very valuable claims. And Dana is going to talk to you about what you can do today to prepare should you ever need to file a claim.
Thank you, Dom. The first thing I'd like to say to all of you is really from the bottom of my heart, from the bottom of our hearts, thank you. We are 2 blocks from the World Trade Center. We were there that day. We are here right now. And in our darkest hour, you came to help us. And I want you to know that there is help available to you, and not just to you, but to your family, because the 9/11 community has paid a terrible price. The first responders have paid and are paying a terrible price. But there's compensation for you, compensation for your family, and you just have to know how to get it. And so there are things that we all should be doing now to protect our families. The most important thing you should do is talk to your family. Don't assume that they know what they're entitled to. Many do not. Many don't know that there's a presumption. They don't know that a doctor doesn't have to relate this. And they might not even be thinking about it when the time comes. And while this process is not adversarial, it's not a lawsuit, there are registration deadlines and there are filing requirements. So talk to your family so they don't miss those. They don't miss the registration deadline. And let them know who to call. If something were to happen, where do they go? Make sure they know that. There are lawyers who can help, there are advocates who can help, and give them that information. Don't let them have to stumble around and find it. The other thing you should do is get in the program. A victim compensation fund claim has different steps. And one of the steps is that the victim compensation fund is going to look at your proof of presence, and they're going to make a determination as to whether you were there and whether you were there for the right amount of time. If you do that, then your family doesn't have to do it later on. It has to be done one time. So even for a minor condition, please get in the program. If not for yourself, for your family. Get your proof of presence in order. We all need 2 eyewitness affidavits. As time marches on, those are harder to find. So do it now. Show those affidavits to a lawyer. A lawyer can tell you whether the affidavit is sufficient, whether it has all the information that the VCF needs. And if it doesn't, you can fix it now and not leave that to your family, down the line when it may be much more difficult to do. And lastly, get a will. So it's shocking how many people don't have one, and it's so important. And so many people tell us, well, I don't have anything, or everything is in my spouse's name. Not everything is in your spouse's name. I'm here to tell you that not everything is in your spouse's name. And one of the most important things that's not in your spouse's name is this claim. A part of the Victim Compensation Fund claim is going to pass through your estate. And if you don't have a will, it's going to pass by the laws of intestacy, by a formula that may not be what's right for your family, may not be what you would have wanted. So that's extremely important. You know, I see where we don't have a lot of time, so I wanted to hit the most important things that I want you to know. And of course, if you ever have more questions about what you can do now, we're here. Get in touch with us.
Thank you, Dana. Just to sum up, this is what we're imploring everyone. Register for the health program if you haven't done it already. Register for the Victim Compensation Fund, even if you're currently healthy. I think we've made the point. You don't want to leave this to your family if, God forbid, you ever get those words that you have cancer. And frankly, if you get cancer in 30 years, it's possible that the other cops or firefighters who went down to ground zero with you, they may not be here to sign an affidavit. So you're going to want those affidavits now, and you'll save them, you'll upload them to the Victim Fund, and then do nothing except go for your annual physical out in New Jersey or Florida or North Carolina, wherever you're living. And hopefully you'll never need those affidavits, but you want them just in case. It's kind of like an insurance policy. So that's securing your evidence. I think you heard from both Richie and Val the importance of seeing a dermatologist once a year, and go for an annual mammogram if you're a woman, of course, although men can get breast cancer, as we have learned. But you know, a lot of women have been postponing their mammograms because of COVID, and the doctors are really very upset about this because they're worried about what's going to happen 10 years from now because of all these delayed mammograms. So go for your prostate exam, your mammogram, your skin exam. That's so important. Get a will. And for us, we just implore you, spread the word. Reach out to your former colleagues. Reach out to the widows of your former colleagues. Make sure that they understand their rights, that they know about next July 29th's deadline. I want to thank Valerie. I want to thank Richie. I want to thank Liam. Thank you guys so much for joining us today and sharing your information and your experiences with our audience. Thank you all for watching. Please help us spread the word to the rest of your neighbors and your colleagues. And it's a privilege to represent the 9/11 community. Goodbye, everybody.